Emily Whitehead is like most fifth graders, full of energy. But this 10-year-old is also a pioneer. We first met Emily 3 years ago when she was diagnosed with an acute form of leukemia. The cancer was growing out of control and doctors were out of options. Desperate, her parents turned to an experimental treatment that had only shown promise in a few adults. How sick was she? Was she so ill that you were frightened?
At one point, the doctor came in and said, "You need to call your family in because Emily's not going to be here tomorrow."
But Emily fought hard, becoming the first child in the world to test a revolutionary technique, changing a cancer patient's own DNA.
Got the virus coming in.
It started with doctors at the University of Pennsylvania and Children's Hospital of Philadelphia.
I think if you asked people back in 2000 and 2002, some of this would have sounded a little bit like science fiction.
Here's how it works. From a blood sample, a patient's own immune cells are separated out and then injected with a deactivated version of HIV. The virus genetically changes the cells, turning them into superfighters that hunt out and destroy cancer cells.
She's cancer-free, and I couldn't believe it. I thought it was a dream.
Today, more than 3 years after Emily's groundbreaking treatment, doctors have seen a 90% success rate in kids like her.
The fact that it worked was absolutely miraculous and gives hope to so many other people.
And now early clinical trials are underway, testing this approach on other kinds of cancers, like pancreatic and ovarian.
It's a little strange to know that she's in a microbiology textbook, but it just...
Emily's story is now literally the textbook example. If someone were to come to you now and to say, "Emily, how can we feel hopeful about our child going through cancer?" what would you say to them?
To never give up.
One little girl winning her battle against cancer, paving the way for so many others to win theirs too. Rahima Ellis, NBC News, Phillipsburg, Pennsylvania.